All right. Well, hello, everyone. Alex Sorosky from the Washington Poison Center here. Thank you so much for joining me for our Career Day Meet a Toxicologist video. So you are likely watching this video during or around National Poison Prevention Week, which is March 20th to 26th of this year. Now, this is a time for everyone, not just poison centers, to consider their roles in protecting themselves and others from potential poisonings. Obviously, poison centers have a lot to say and contribute during this time. So if you think that poisons and toxins are just fascinating, and if you think science is awesome, and if you want to help people, then boy, do we have the field for you. So I am thrilled to introduce Dr. Kate Brown, the Clinical Managing Director for the American Association of Poison Control Centers. So Dr. Brown, thank you so much for joining today. Is there anything you'd like to say before we dive in?
Hi, Alex. No, thanks for having me today. I'm really excited to be here and share my love and enthusiasm for the field of toxicology. I can't agree with you more. It's the perfect field. If you love science, you love to help people, and you're fascinated by toxins.
All right, perfect. So let's dive in. So for myself as well as others, what the heck is toxicology? What does a toxicologist do?
Yeah, so a toxicologist, or the field of toxicology, is just the study of poisons, right? So toxicologists actually can take many forms. They can study many different aspects of how poisons interact with a number of different things. So I'm a clinical toxicologist, which means that I study poisons, specifically the diagnosis and treatment of poisons in humans. But there are other fields of toxicology like environmental toxicology that will deal with chemicals, other hazardous substances in the environment. There's more like analytical toxicologists or applied toxicologists that look at ways of detecting chemicals or toxins. So there's really a lot of different applications to do, but mostly what you'll find is clinical toxicologists and medical toxicologists in the poison control center world. And those are the ones that are primarily dealing with diagnosing and treating people who've been poisoned.
Absolutely. Thank you. That was an excellent answer. Thank you very much. And I just love what you're saying about like how there's so many applications in this field and like so many pathways to it and from it. So for you specifically in your journey, what drew you to this field? Was this something you always wanted, or was there this specific moment when like this pathway clicked for you?
I had a very serendipitous way of entering toxicology. It was completely unplanned, actually. So I went to pharmacy school, as a lot of us clinical toxicologists do. So I have my primary degree is a doctorate in pharmacy. So that meant I could have gone and I could have worked at a hospital as a clinical pharmacist, or I could have been, the retail pharmacist that you see at Walgreens when you need to go pick up your medication. And I ended up not really thinking that those were a great fit for me. So while I was in pharmacy school, I always loved pharmacology, which is the study of how substances interact with receptors in the body to produce beneficial responses to help treat certain diseases or conditions. So I was really into that, and I thought I wanted to study that at a benchtop level. So, right, go into the lab, work with cell cultures or work with mice and figure out new treatments or new drugs for things. And I did that for a couple of years. I was really fascinated by neuropharmacology, so specifically in the brain. And I didn't know how to carry that forward as a pharmacist. But fortunately, while I was doing a experience in one of those labs, the poison control center was right upstairs. So that was my first interaction with a poison center in college, because my college wasn't associated with one. And I kind of had in the back of my mind, oh, toxicology, that's pretty neat. I think that's something that I could be interested in, because it really is a union of pharmacology to understand toxicology. So I thought that was a great option for me, and ended up just applying for a fellowship in clinical toxicology through a poison control center, and had no idea what I was getting myself into. But luckily, I fell in love with it while I was working at the Poison Center. Um, Everything the Poison Center does, the mission to help the public, a free public service, to help save people when they've made a mistake, or um, people who have accidentally just been in an area where there's been a gas or a fume that's caused them trouble. I just thought, what a great way to use my pharmacy skills and extend that into toxicology and help people. So that's kind of how I fell into toxicology.
I love that. And, I agree that poison centers are this, I mean, in some ways, really radical constructs that, like, literally anyone with a phone can access anytime. No charge, no billing, no insurance, nothing like that. And I just think that's great. So I thank you for your contribution to all of this. So what have been some of the biggest challenges to overcome, whether it's you personally or for anyone navigating this route to or any route to toxicology?
Yeah, so it's one of those things where there isn't a lot of people out there saying, hey, you should go work for a poison center, or hey, you should be a clinical toxicologist or a medical toxicologist. So I'm thrilled to be here to share with people. Just one, I think that's a barrier, knowing that this career is an option and how rewarding it is. So one of the main barriers I experienced was just my total lack of knowledge of a poison control center. And especially while I was in my studies, I wasn't very aware of poison centers. So now as an educator as well in colleges, I take every opportunity I get to speak with kids in college that are on the track to a healthcare profession and teach them about toxicology and how it's an option. The coursework to becoming a toxicologist, I think it's very challenging too. You really have to be interested in physiology, so all the ways the body works, and then understanding how the chemicals and drugs that we put into the body affect the physiology ultimately. If you don't like that, or you're not in love with that, it's going to be very hard for you to love toxicology and pursue it, because it is a challenging field. And then lastly, does take a little bit of schooling and discipline to get there. So that's another barrier. To be a clinical toxicologist, you have to have a degree in pharmacy, or potentially another equivalent field, and then take a board exam in clinical toxicology, which usually requires you to do additional training for a couple of years, working with patients, working at a poison center. So it's a long career path, but very rewarding. And once you get on the train, you really can't hop off because you love it. That's what I find. All of my students who have ever come through our poison center are always they secretly fall in love with toxicology. Even the ones that thought they wouldn't like it, they are convinced that's what they want to do when they're finished, because it is such a unique field.
Absolutely, and like you said, it's such this hybrid of all these other disciplines kind of converging together, and that's just excellent. So you mentioned, that there's so much about this you find rewarding. So what do you find rewarding about this kind of work?
Yeah, that was what really sold me for poison centers, was the rewarding aspect, the satisfaction I get from helping people. As a pharmacist, you do have a lot of opportunities to help people. You're helping people access medication to help keep them healthy. You're helping people in hospital get the appropriate treatments. And you don't always get the direct gratitude from the people you're helping or the patients you're helping, because there's a lot of other layers in between you and the patient. They're having to pay for bills related to the drug or to their hospital stay. So there's a lot of things that can get in the way of you really seeing what an impact you made in that person's life. So for me, working at a poison center was the ultimate satisfaction. I used to do work as a specialist in poison information. I would talk directly to patients on the phone or talk to the parent of a patient. And within 3 minutes, I was able to completely calm them. They were so grateful and thankful for my time. And I just love being there to reassure someone who thinks that, it's a scary situation when your child or a loved one or yourself gets into something you think is potentially going to harm there's no better feeling than hearing that relief in that short period of time than what I get from working at a poison center. And on top of it, it's just also it's a public service. You know, we are able to affect public health at a large level. We're able to make the world a safer place. Even if we're not directly communicating with people, poison centers are out there, you know, teaching people how to avoid getting poisoned and what to do and be prepared if it does occur. So overall, for me, it's just this perfect, unique environment where you directly see the positive change you're affecting in the world, one, in a really quick fashion, and two, also in a long-term sense.
Oh, that's awesome. I love that. Now, for folks who don't know, to make sure we're all on the same page here, because we reference phone lines a bit, this is the number to access your local regional poison center. So 1-800-222-1222. That's your homework, is to make sure you have access to this number whenever you need. And anyone can call anytime. All right. So one more question for you, Dr. Brown. And thank you for your answers. They've been just excellent. Now, is there anything else you'd like to share with our viewers, especially any viewers who are youth or young adults, or honestly for anyone who may be at this period in their lives where they're rethinking their career, or maybe they're in pharmacology and they've heard of this mysterious toxicology thing? Anything you'd like to share with those folks?
Oh, absolutely. So one of the things I'd like to say is if you have any interest or want to learn more about poison centers, go visit your regional poison control center's website. Reach out to someone at that regional poison control center. I would say that the community of poison centers in general, medical toxicologists, clinical toxicologists, our educators and administrative staff, it's a very welcoming world. We always want more clinical toxicologists, specialists in poison information, medical toxicologists. So if you're interested in any capacity, reach out to your regional poison center. I'm sure someone there would be willing to talk with you a little more about what your options are. And they may even be able to give you some more materials on how to pursue what you're interested in, or give you more perspective on what career path might fit best for you in the poison world.
Fantastic. Well, thank you so much for sitting with me today and helping put this video together. I love all of your answers. So just every time we do this kind of interaction, it gets me that much more excited about the work we do with poison centers and poison control centers. Well, folks, I hope this was informative for you. And I hope you are able to engage with National Poison Prevention Week. And again, don't forget to call at any time if you have a poison emergency, or even just to get information about a potential poison. You can always call the poison helpline, 1-800-222-1222. Thank you so much. Take care, everyone.